120 beats a minute. It's about 2 every second. Quite quick in a baby. And that's it. It's as simple as that. And you keep going until help arrives. Even though it's only small, sharp movements, you should alternate who's doing it because you'll get tired and get exhausted and you'll lose count, things like that. So, it is clean.
Yeah, it's fine.
You need to demonstrate that you can make a good seal around the face, do 5 rescue breaths and then 1 round of chest compressions. Simple as that. One of you can go first. It does taste a bit soapy, I can only apologise. Imagine it's your baby, you wouldn't worry about it.
No.
So go from the top. The CPR bit's simple, so we'll go through the whole thing. So you don't need to check for danger, we know it's nice and safe. But how would you check a response and then check the airway?
No tickle.
No, nothing.
No shoulder squeeze.
No, nothing, not even wincing, nothing.
Check the airway.
Yeah, it's all clear.
Oh yeah, call the ambulance, Jamie.
You're very calm.
Yeah.
Okay.
And then we tilt his airway back.
You can either tilt the head, tilt the chin, or pull the jaw forward.
Yeah, and there's nothing in there.
No.
No.
What would you do if there was? Yeah, you can just tilt it, you can flick it out. Yeah, it's good. Okay. Okay, and then and now so you've done all that, no response and no breathing.
Flat surface. Open the airway. And then 5.
You really don't want to do it, do you?
Spontane's over.
Oh. We just do 1, just so you've definitely got the technique down.
Cover the nose.
Perfect. That's
Okay.
perfect. So as long as your mouth covers their mouth and nose, it's fine. And then chest
And then
compression.
1, 2, 3, 4. Oh god, it is quite tough,
It's
isn't it?
Yeah.
Try.
There's the 2 techniques for a reason. I find going round and
Oh, yeah, that's
supporting thumbs is
easier.
much easier. You also get a bit more control about the depth of the compression. So the depth is about 1/3 the depth of the chest. If you think a baby's chest is only about that deep.
So are you gonna like break his ribs and stuff?
Babies know. If we were doing adults, yes, almost certainly. But babies know that their skeletal structure is really flexible, so they don't really break.
Squishy.
Yeah, they might. When later on, they might end up with a little underlying rib fracture. But yeah, it's unlikely you do the level of trauma you do to an adult because they've got really pliable, compliant chests. All right, Jamie, you're up. I can wipe it, but she is your wife.
Fine.
Yeah. Cool. So we'll go for top. So just very quickly, just check that. Check for a response. Check the airway and check for breathing.
Okay, so
Yeah, nothing.
Okay,
No tickles. Not
shoulder.
working. Nothing. Not
It's
wincing.
not
Not doing
working.
anything.
okay, dial 999.
Mhm.
Check the airways. Nothing in there.
Everything clear?
See
Yeah.
who's breathing.
Yeah.
Nothing
You
happening.
can't hear it. Can't see it. No.
Colour is circulation. I don't know.
Yeah,
what
no,
it's
at
like.
this point you've got no breathing, so you can move
No.
on to CPR.
Okay.
So remember what you start with, 5 rescue breaths. So this mannequin, it doesn't feel like you're putting air in either, but genuinely these are anatomically accurate in terms of the lung volumes. So that just means that small amount is literally about 30 mil is all that it takes to inflate the lungs.
So you're not gonna try and blow it up like a balloon?
No, you're literally, the amount of air coming from you into the baby is your dead space, your natural dead space from here in your trachea to your mouth. That much air. Nothing from your lungs is even going into the baby.
So they're getting oxygen.
They're basically getting air. They're getting room air because they're getting unexpired air. Yeah, because you're only inhaling. You're pushing in ambient air effectively.
Is there a danger that you'll push too hard and?
No, because you'll know. You'll see it and you'll know.
Right.
And to be honest, this technique, so there's two routes the air can take. So it can either go down into the lungs, which is what we want. Any extra air, if you fill the lungs, the way the anatomy will work, the air will go down the next path of least resistance, which will go to the stomach.
Right.
So all you'll start doing is inflating the stomach, and you'll know. You can't do harm. You can do harm by doing nothing, but you can't really do harm by doing something.
Right. Okay.
So, CPR.
So I've done my 5 breaths. What's that?
That's good. Does it feel like you're going? Yeah, I was gonna say try both. You'll notice that this will.
Yeah, that's definitely harder.
Yeah.
Cool.
Just go one more time. So it's quite. It's more than you think.
Ah, right.
Yeah. So try once more. You, like I said, you wouldn't do any harm in what you're doing.
But
The other benefit of doing good quality chesting, getting this technique right, is we'll get onto it in choking, but it's the same technique for if you can't dislodge something choking. And the reason for that is you're changing the interthoracic pressure here, which causes some natural expiration of gas. So by doing it, you can hear it expiring, and when the chest recoils, they inhale. So you actually, by getting good chest compressions, you're also optimizing their ventilation, which is really good.
Right.
Cool. Go. Clean. Do you trust my cleaning abilities? There you go, you can have a wipe.
Okay.
Okay, we're doing good. We're at 17 minutes. Long time.
Okay. No danger.
No. Do you want me to go back for you?
No, it's fine.
You don't?
No danger. So wake up.
No,
Not
no.
waking up. So dial 999. Help is on its way. Right, checking the airway. So
Good. It's nice and clear.
nice and clear.
What comes after A? A, B.
A, B, yeah, breathing.
Yep.
So I'm going to listen to.
Nothing.
Nothing. Right.
Or it's
so-
very, very shallow and slow.
Yes. Right. Okay.
What,
Next
what
one.
does that mean? It's very, very shallow, irregular and slow.
It means that the heart is if it's regular and slow, the heart's still going.
But is it effective?
No.
No. So you still move on. Good.
Right. Okay. So I don't open the airway.
Yeah.
And I'm going to do 5 breaths.
So nose and mouth. So it's a bit different to big
Yeah.
child and adult CPR. Very good.
Right, okay. And then 30 chest compressions.
So a little bit faster. 2, 3, 4, 5, 6, 7, 8, 9, 10. It's good. It's good rate.
And that is very different.
It's very different, yeah. There's
that's
slightly
good.
more compliance in a real baby's chest, but
Yeah.
it takes more effort because you're using a more focal point. You can't, and you can almost do, you know, like CPR is hand on top of hand. You can, on most babies, get your thumb on top of thumb, so you can kind of, you're getting twice the force through. So yeah, it's. I think it's harder to do it.
So until hope comes, you just do 2 rescue breaths and then 30
That's
compressions. 2 rescue
Yeah, or until baby starts crying or waking up or moving, doing something purposeful.
Okay.
Last but not least,
There we go. So, airways.
Really goes now.
Really goes down.
yeah.
Airways, airways all clear.
Imagine it's only probably had a few hundred people practice on it at least.
Try the
Do you want to
Give
go?
the stars.
Right, so
danger, no danger. Check the response first. Yeah. So, come on.
No, nothing.
Nothing.
no wincing, no nothing.
No, nothing. No, nothing in the mouth.
Nothing in
Check
the
there. Have a look at this one. Nothing there.
Can't hear anything.
No, so he's laboured and he's not. So, hold the head back slightly.
Yeah,
Mouth over nose and mouth.
yeah.
5.
Small, sharp inflation breaths.
5.
Yeah,
And then
yeah. Link round, thumbs in between nipples, and then 2, 3.
it is quite hard, isn't it?
Yeah.
30 of them. And 30 of them, and then back to.
Back to back.
There's no weight or anything like that, or do you check again? Or anything?
The only difference, you'll notice a small difference, which I should have highlighted, is the initial breath is 5.
Yeah, and then
The rest, after that, if it goes back to 30 to 2, which is the same for adults, so normal CPR. So the only reason for these extra breaths here is because we said earlier, the likelihood is this is something to do with breathing, airway obstruction, or oxygen related. It's more likely to be a hypoxic event rather than a cardiac event because they're nice and movable. Okay.
2 questions.
Go ahead.
One, would you do anything differently if they have a blocked nose? If they've got a really snotty, blocked up nose?
No, but you can just routinely, which you probably will gross you out even more, you can just suck babies' noses. As long as their
we
mouth
have a
is
snot
open.
sucker for that. I was wondering whether you would use that first, whether you would clear their nose first.
No.
Because it's still going to, presumably, if you're blowing and their nose.
It's gonna go. It's either going to go into their upper airway, which is obviously not a big problem, or down into their stomach. So no, if they had a bit of snot, you got to think the volume. Sorry for dragging a baby across the table. The volume of the nasopharynx, of the upper nose,
half as
tiny.
full.
Yeah, it's like less than both of them are fully blocked. You're talking less than 5 mil, like of fluid. So their mouth is the main thing. If there's anything in it, you can try and get out, and you can move them, which we'll get onto and flick it out. But you're not gonna blow the baby's nose or anything like that. It's not sucker. If there was loads, it might be easier just to suck whatever is in their airway out, spit it to the side, and then blow, rather than trying to fish it. That's up to you.
Okay, second question. At
Go
what
on.
age would you stop covering their nose? When do you switch to
As soon as you can't do it, there is no
Okay, So
age.
if they're big enough
Yep.
that you can't.
Yep. Then the only difference being if you can't do it, so air will always follow the path of least resistance because it's just the gas. So if you blow in here and don't include here, the air will go in, and your nose. You've seen these people with spaghetti when they can put spaghetti up their nose and out the mouth, and they can. It's because it's all linked. It's all open. Your upper airways. So if you blow into the mouth, there are structures that make gas and food go certain ways in the airway, but there's nothing similar to up here. There's no structures that do that, no epiglottis or anything. So if you blow in here without including the nose, it will just come straight out.
Okay. So you'd always make
So,
sure the nose is
yeah,
blocked.
if you can cover both, you cover both of your mouth and blow in. If you can't, because they're growing to a point that you can no longer reach it, you just pinch the nose. So that you're directing the air the only other way it can go.
Okay.
Does that make sense?
Yeah.
Cool.